You can go. We're here again, and Charl, it's so interesting talking to you. We're just going to divide it into 3 segments that Jenna composed, and Lou has been reminding me of a couple of things. So I don't quite know where to go from here. We're talking about COVID vaccine, and the last segment we discussed vaccines and the safety about vaccines. And I'm going to pop from there and ask, because there's so many vaccines, and people ask me, is it changing their body's DNA and RNA? And maybe you want to explain that. Don't ask me to explain it. And then why are we not giving it to our children? I get asked, I'm not having it if you're not giving it to my kids.
Yeah, those are 2 great questions. So in the last segment, we talked a little bit about the types of vaccines,
right,
but we probably didn't finish the type of vaccine.
Absolutely.
So that'll help explain the DNA type question.
Yeah.
So the types of vaccines, very briefly, that get made, and it's really just the different science in the laboratory to create this code carrier. Remember we talked about the vaccine being a set of instructions?
Yeah.
It needs a taxi to travel.
Yeah.
And the taxi that code travels in depends on what the lab decides to use. But a common taxi for the code is another virus. So, for example, some of the viruses, some of the vaccines that we make are carried in a different little virus, often like an adenovirus. Adenovirus is something that, for example, causes pink eye. So an adenovirus can cause pink eye. In the lab, they can use a different kind of adenovirus as a carrier, and some of the coronaviruses are made that way. Right? Some the coronavirus vaccines are made that way. So they are.
And again, we can't pick it up.
Adenovirus
Can't pick up.
carrier. So the J&J vaccine, for example, functions a bit like that. The Pfizer vaccine and the Moderna vaccine, they're using an even cleverer technique for getting that piece of code into our body. So they take a piece of the code of the virus, which is why they're called mRNA. It just means they're using messenger RNA. M is messenger, it's a piece of code. And they're using that piece of code as the training program for your immune system.
So can that go into your cells?
It absolutely goes into your cells. Everything is either in your cells or just floating around your bloodstream, but it can't go into your DNA. Your DNA is not your cell. The DNA is sitting in the nucleus of the cell. Your genetic code is sealed off in a special little parcel in the cell. All the rest of our life goes on in the rest of the cell. So it gets absorbed by blood cells and muscle cells and whatever other cells. That's where medicines work. But there's no medication that will interfere with your code. You have a recipe that makes you. There's nothing that we can put into you that changes that recipe.
So if you're taking this little thing and you've got a bit of mRNA and it's going into your cell, then people want to know, well, if it won't change your DNA, because if you think of how cancers work, cells have baby cells. So how do you know that it's not going to change the next cell and make the next cell different so that you can suddenly grow arms and legs and weird things?
Is built around following a set of instructions.
All
cells follow instructions.
Except for cancer cells.
So, well, even cancer cells. The point is that you can't give the instructions for the microwave to the video recorder. The video recorders can't do anything with the instructions for the microwave. It's the same argument. The microwave will only follow microwave instructions. So your cells will only follow instructions from your code. We get diseases like cancer that interfere with that recipe, the coding delivery. And that's why those cells
Genetics
go
and
all wonky, right? But it's not because
the vaccine's not going to do that.
Vaccine can't do that. Physically impossible.
Because all it's going to do is recognize, so it's going to make one of your cells. So how much when you're not getting enough for all your cells. You're getting enough that it goes in and a couple of cells go
we don't
high.
We don't protect cells on a volume basis. What it is we are training your immune system to respond, back to the gym story, when needed. Right. So the immune response, which is the antibodies that you need to produce, you need the training, so that's the vaccine, and then you need the trigger, so maybe the virus arriving, and then you will produce antibodies to deal with the insult of the virus.
So why don't you get it in your arm?
we can put it anywhere. We need to put it into some muscle.
Okay.
Right? So muscle is the easiest place to put a vaccine. Right.
Hard to get hard
and
to
the
get
easiest,
to my muscle.
The easiest muscle, the most polite piece of muscle to find is your deltoid muscle, your shoulder, your arm. Okay. We could, in theory, put it in any muscle.
Okay.
It's just easier than asking people to take down their pants in the vaccine center. It's easier to just show your shoulder, right?
Okay.
So that's the only reason you get vaccines in your arm. It's because it's polite.
And it's going to the muscle because that's where
the easiest way that we need to absorb it. Absolutely.
Right.
We need to absorb this medicine.
Yeah.
If we just stick it in the skin, then we're not going to get things absorbed very well.
Yeah.
So we stick it into muscle, like we inject many other medicines into muscle. So if you get an antibiotic, if you get any other medicine that you can't take by mouth, we have to inject into muscle. That's commonly where we put it.
So I often use an analogy, more by mouth, lost in your gut,
some
easier on the muscles, sometimes in the bloodstream.
Medicines that go by mouth are actually very clever medicines because we have to provide a very special taxi to survive your tummy, right?
Yeah.
So survive the acid, survive digestion, survive all sorts of things, so that there's some medicine left to do some work, right?
Yeah.
So medicines by mouth is quite a thing. Now you asked about children and why. So the vaccines that have been around for a long time that we've had time to test and safely use in kids, we use in kids. Measles, mumps, rubella, etc. The coronavirus vaccines, because they haven't been around for that long, we haven't yet done extensive trials in kids yet, right?
So it's because the trials started in adults?
Absolutely.
Okay.
We started the trials in the most at-risk population.
Not because we're scared to give them to our kids?
Not remotely. We start the trials in the populations where they're going to have the most benefit. So older people.
Yeah.
We saw when this SARS-CoV-2 virus hit the world that the people that suffered the most were elderly, people with comorbid conditions. And so all of the vaccine trials were in those populations to check that they were safe to use, which they clearly are. And the millions and millions of doses that have been given around the world have easily proven that. If we compare the number of side effects or complications to viruses to the vaccines versus the number of doses that have been given. So we can't give it to kids yet, just because it's not registered for kids yet. It will be, I have no doubt. It's already registered for kids in some countries overseas, older kids. So the Pfizer vaccine, for example, in the US, I think is for 12 and over. Right.
So would you give it to your kid under 18?
No questions.
Okay, that would be my kid too.
No questions at all. As soon as it's available, administer it to any child that's
because do kids spread it quicker?
Right. So kids spread viruses for lots of reasons. They're slightly less careful with things like masks and hands and clean stuff. So the behavior of viral spreading is easier with kids, just because they're messy little grubs, right? Two is kids are often in communal environments. Kids in classrooms, kids in schools, kids in creches. Little Johnny goes to play with somebody else. There's kids mingle with kids, whereas adults have a easier ability to socially distance and stay apart. Right? So kids are effective spreaders. Also remember, kids have got quite powerful immune systems already. Kids are dealing with viruses and bacteria all the time. So kids' immune systems are already doing a bit of gym. Kids go to PE at school, right? Adults don't. So kids are already doing training. So their immune systems are already revved up and dealing with stuff. So a lot of kids don't get severe COVID-19. They still get the virus. You might not even notice. Remember, 80% of people who get COVID-19 don't have symptoms. So that means if 10 people get this virus, only 2 of them are we going to notice something, right? Most of them, it's not. I mean, our rugby captain got COVID-19 just the other week, and he didn't even notice. He didn't know. He said he felt absolutely fine. He just got a positive test, so he had to wait it out. He was super fine, right? Probably because he does a lot of gym, right? But the point of the story is that kid safety is merely a timing exercise.
So can anyone get the vaccine? I know we did this with Devin, we did this. Lou, you've had it. She had cancer many years ago. You've got all sorts of weird and wonderful other things going on. and you had the vaccine. So anyone can get the vaccine.
So the question is, are there contraindications to getting the vaccine?
Yes.
Very, very, very few.
Yeah.
Very few. There are a few. There's always some people that can't take a particular medicine. Right. Let's eliminate the obvious ones. Okay. So if you've got cancer, you certainly can take a vaccine. If you've got an immune condition like HIV, you can have the vaccine. Right. If you've got a renal disease, you can take the vaccine.
Contraceptive pills,
if you're on absolutely, you can take it. Taking other medications, you can take the vaccine. Right. The vaccine, like any medicine, might, in a very small percentage of people, cause what we call an allergic reaction. You can get an allergic reaction to anything. You can be allergic to shellfish. You can be allergic to penicillin. I could be allergic to my mother-in-law. You're allergic to anything, right? All I have to do is avoid the mother-in-law and I'll be fine, right? I can't necessarily treat that situation. I just have to learn the trigger that my body doesn't like. Now, it's possible, and we've seen a few cases around the world, but like very few, that your immune system could be allergic to the carrier liquids in the vaccine. Those little chemicals. There are a few of them, polyethylene glycol, a bunch of others. They got long names. So if you happen to be allergic to polyethylene glycol, you might be allergic to one or two of the vaccines. Okay.
So do you still take it and then take an antihistamine?
No. What we would know beforehand, we would ask you questions about, are you allergic to anything? And you'd say, yes, I'm allergic to bees. And we'd say, thank you, no problem. Bee allergy doesn't mean you're going to be allergic to the vaccine, so you can safely get the vaccine. If you said, I'm allergic to this particular chemical, which you would only know if your doctor had told you, then we'll say, you might be one in a however many million people that can't take it. But that is like so unusual. Allergy to other things is not a contraindication to the vaccine. And all the vaccine centres, like the one outside here, all the vaccine centres are prepped and ready. So if somebody does, by some remote chance, have a allergic reaction, it's going to happen within a few minutes of the vaccine anyway. And that's why you're told to sit down and wait. You have to sit there and twiddle your thumbs for 15 minutes, and that's why we're waiting to see if anything happens, if you feel. And so far in South Africa, in all the doses that we've had, we haven't had any hectic allergic reactions.
Okay, so clots.
Right, clots.
Okay.
Right, are we talking about blood clots? We're not talking about people who make silly decisions, right? So, because there are a lot of clots out there. Okay, so to all the clots. So blood clotting is quite a complicated process in the body. It's normal. Okay, and it's a series of cascades. Okay, so one causes two, causes three, causes, and it's like a little trigger event, little domino effects. Okay, and clotting is affected in different parts of the body. So it could be the clotting agents that we produce. It could be how we clot. Could be skin related. Could be all sorts of things. Some of the vaccine receiving people, in the period after they got the vaccine, experienced a clotting complication. Okay, they got a clot in a sinus in the brain. Okay, which was it was quite a serious condition. And that blood clotting event, because it occurred in that time period after the vaccine, it had to be reported as, well, it could be related to the vaccine.
So that's like if I take a medicine and I get itchy all over, we have to report it. If it's not written as a...
We have to document those as side effects. That's a safe way of dealing with the medicine. We still don't have any clue as to whether the vaccine actually caused that clotting event,
or something else.
Okay, we've got no clue. There's no science that connects the two. We just think, well, maybe that's what happened with that particular drug, right? But remember that all drugs have got potential for complications and side effects. Every single drug, from aspirin and Panado to the simplest antibiotic to a chemo agent to a vaccine, they've all got some risk of a side effect. It's just getting in your car and driving to work has got the risk of a side effect. The side effect is being hit by another car and being involved in a car accident. Everybody still gets into their car. They know the risk. Okay,
you said that to me when I fly.
Your risk of driving from A to B includes being hit by another car. Everyone still gets in their car. Okay, because you've programmed that risk in. Okay, you know about it. right? So you deal with it. It's part of life, right?
Yeah.
So you take a Panado for a headache. There is a risk that you're going to get a serious complication from that Panado.
Yeah.
There is a risk. It's not zero. But the risk is so small that the safety people are happy to say, take the Panado, because honestly the benefit outweighs that.
So is the risk of taking a Panado greater than having a vaccine?
It's in a, let's put it in a different way.
Yeah.
You stand more chance of being struck by lightning than having a side effect complication to one of the coronavirus vaccines.
Sure. Okay.
And I don't see people worrying about being struck by lightning.
No.
Okay.
No.
If we go back to the clotting example,
right.
So the risk of clotting, we think, relating to a vaccine, is measured in 0.00000 something percent. I can't remember the something.
You had 6 noughts and then a 1.
It's a very small number. The risk of that same clotting problem happening if you are pregnant is more than 100 times more.
Okay.
So if you're worried about clotting, forget not taking a vaccine, don't get pregnant, don't take the oral contraceptive pill, don't get COVID-19 either, because COVID-19 increases your risk of clotting. Okay. So there are so many other things out there that increase your clotting risk.
If people are anxious, should they take a Disprin when they have the vaccine?
Take nothing. The general teaching is do not take any other medicine at the same time or on the same day as your vaccine. Not because we're trying to decrease symptoms, but what we want to do is we want to get a very clear picture of if anything happens on the vaccine. Okay. So if you're going to get a headache afterwards, we'd rather know about it.
Right.
Okay. If you're going to feel like you've got a little cold and shivery thing, we'd rather know about it.
Okay.
Right? And then we can treat it.
Yeah.
But then at least we know.
Okay.
And by the way, if you get those cold and shivery things after taking a vaccine, which is quite common, it's probably your immune system doing gym.
Yeah. So does that mean your immune system is well trained?
Your immune system is busy.
Or does it mean you've had the virus before?
We don't know.
Or does
because if you've had the virus before, then your immune system's already done some gym to that virus, right?
Okay.
So now a better question should be, if I've had the virus before, do I still need to get the vaccine?
About that.
Right. Answer yes.
Okay.
Why? Because of our discussion on variants. So if you've had the vaccine, if you've had the disease, you had one type of this disease, right? You didn't have all of them, you had one.
Yeah.
Okay. The vaccine is effective against a whole range of variants.
Okay.
So
but not all of them.
Not all of them, but certainly a whole bunch more than zero.
Yeah.
So if you've had the disease, you are now have natural antibodies to that variant.
Right.
Great. That'll last for quite a long time. We don't know how long. We hope a year plus.
Yeah.
If it's a natural infection, maybe longer even.
Yeah.
But we'd like to protect you against all the variants.
Right.
So the vaccines have shown efficacy against a range of the variants.
Okay.
So definitely, if the question is, I've had COVID-19, can I take the vaccine? The answer is yes.
When?
At least a month after you get better.
All right. Okay. Lou, if you got any questions, then we'll go over all the myths.
Herd immunity. I'm not going to get vaccinated because everybody else will have herd immunity and it won't affect me.
Herd immunity is probably never going to happen to this particular coronavirus.
What's herd immunity?
Because it keeps changing. So herd immunity is a concept which makes sense, that says if enough people in a closed community, in the herd, so enough sheep in the field of sheep, all right, get protection against the virus, and they get protection either by having the disease or getting a vaccine. If enough people have that protection, then they're not going to spread it to the next person.
Yeah.
How many is enough? We think it's about 67%
of the population.
So if there are 100 sheep, 67 sheep have had the vaccine or had the disease. Chances are the rest of the people are going to be safer because of that community. However, that's only if it's 100 sheep staying in that field. We don't live like sheep in one field. We move around, communities change all the time, plus the disease is changing. The virus is changing.
So it's kind of like flu.
So can we develop herd immunity to flu? Probably not, because flu is always, it's a slippery little eel of a virus, right?
Yeah.
Same story with coronavirus. Herd immunity will we'll always be trying to get there, but we probably won't get there completely.
But then why must we vaccinate?
So there's three people that you're protecting when you vaccinate.
Right.
Okay.
Yourself.
You're protecting, well, we can talk doctors, so we're protecting patients.
Yes.
Okay, because you don't want to go and see a doctor who might make you sick.
No.
Okay, so I can't work in a hospital if I'm now potentially making other people sick.
Yeah.
So I'm certainly going to take the vaccine and have done. Let's make other important people. Okay,
Right.
Family.
Yes.
Do you want to make granny sick?
No.
If you make granny sick, she might die.
Mm-hmm.
Yeah.
It's very obvious. Okay, so you, by being able to carry the virus, particularly if you're not vaccinated, makes you a far more risky carrier of the virus. You have the very real chance of making a vulnerable person sick.
Yeah. My Kung Fu Panda diabetic child.
Exactly right. So anyone that has a comorbid condition or is an older age group is at higher risk. And then lastly, yourself. So protecting yourself against the virus just makes sense. Yes, you can drink ginger tea. Yes, you can take echinacea and turmeric and drink green juice. Okay, wonderful. Your immune system benefits from all of those substances. Okay, those substances are generally good for immune systems, we think, right? They're certainly not doing anything specifically targeting coronavirus.
Okay.
So while they might help you to be generally healthy, the only way to train your immune system to deal with those viral recipes is that vaccine.
Okay. So next segment we're going to talk about the goats, not the sheep.